Hey there! Today I'm diving into the world of heart transplants. Did you know your heart beats over 100,000 times a day, pumping more than 5 liters of blood? But, unlike other tissues, your heart has limited self-repair capabilities. When it gets severely damaged, a transplant might be the only solution. Every year, about 3,500 heart transplants are performed worldwide. It's a complex and precise procedure with no room for error. So, how does it all work? First up, selecting a recipient. Potential recipients undergo rigorous testing to ensure they are healthy enough for the surgery. Doctors look for any immunocompromising illnesses or conditions that could hinder their survival. Then, there's donor matching. Eligible recipients are matched with suitable donors, often patients who've suffered fatal events but have healthy hearts. Registering as an organ donor and having family consent is crucial. Matching involves checking blood type and antigens to minimize rejection. Once a donor heart is available, it's preserved in ice slush and a cold saline solution, but it only has a few hours of viability outside the body. On to the transplant procedure. The recipient is put under general anesthesia. Surgeons make an incision in the chest to expose the heart. A cardiopulmonary bypass machine takes over the heart's function during the surgery. The old heart is removed and the new one is sewn into place, connecting vessels and arteries. Post-surgery, the new heart isn't directly connected to the nervous system, taking years to fully innervate. This results in a higher resting heart rate and increased stroke risks. Exercise starts out difficult and dangerous, and immunosuppressive drugs are necessary to manage rejection, but they increase infection susceptibility. Despite the challenges, about 70% of heart transplant recipients survive at least 5 years, with 20% living another 20 years. Unfortunately, access to transplants is limited in developing countries due to legal, regulatory, and donor availability issues. Excitingly, 3D bioprinting is being explored as a future solution for donor shortages. So, that's how heart transplants save lives. See you next time.